Your back affects your daily health. Welcome to another installment of Your Spine, Your Health.
Our spines are what give us function and form, and our job is to make you an empowered health consumer, and we do that by letting you know you have a back. That may sound a little funny, but when you wake up in the morning experiencing chronic pain, the last thing that's going to come from your mouth is, I have a pain at C1, C5, or any of the 7 vertical vertebrae known as Cs, cervical vertebrae. The spine is broken down into 3 regions by varying names. However, the predominant ones are neck or cervical spine, thoracic, mid-back, and lumbar low back. Today's message is more around the first cervical vertebrae. Its friend, the one above that it joins to, is of course the skull. Its one just below is known as the second cervical vertebrae. And these vertebrae in our spine form an extremely unique complex important to daily function, primarily movement, and then associated nerves, blood vessels, and muscles. But what makes that first cervical so unique is if you take a look at pictures of it, you'll see that its shape is totally unlike any of the other vertebrae. And it also is deeply involved in function and movement and protection of those nerves that leave the brain and start to enter the spinal column. Chronic neck pain affects people on a daily basis. They form headaches and other issues that we're going to talk about in later shows. Chronic pain in that area of the neck can easily result in a sharp piercing pain right below the skull. And if you're driving a car, as an example, you may have a great deal of difficulty looking left or right. If it's in a child involved with sports, the range of movement of the neck also will be affected if an injury has happened to the upper body. So simple range of movement, looking left, looking right, are simple examples how you can detect that chronic pain and where in your spine it is coming from. Chronic neck pain affects all ages, young and old. It only changes in terms of the circumstances that may have caused it. Starting at that first cervical vertebrae, it is important to think about lifestyle, work habits, and proper treatment procedures at all ages, young, middle, and elderly. Remember, it's not a chronic problem just because you're young, and it's not a chronic problem just because you're old with arthritis. There is a relationship in these areas that starts with that first cervical vertebrae. Get that assessed, look at your lifestyle, look at your exercise routines. Lifestyle exercises should always include simple range of movement. Remember, it's not just about strength. It is about range of movement, shoulders and elbows as an example. Your spine is simply 24 more bone joints, and when you're seeking to cause exercises, make sure it's not just about muscles, but make sure you add that issue of movement and flexibility. Remember, your back is important to your daily health. Join me on the next show as we continue our journey down your spine.